Fetal hemoglobin and development of retinopathy of prematurity in preterm babies. So ROP is a multifactorial disease primarily affecting the premature retina of infants. Apart from birth weight, gestational age and oxygen, there are multiple biomarkers that can affect the development and course of ROP. One of such biomarker is fetal hemoglobin, which are predominantly present in neonates at birth. HbF is the main oxygen carrier protein in the human fetus, which is involved in transporting oxygen from mother to fetus. The aim of this study was to find an association between fetal hemoglobin concentration and development of ROP in preterm infants. So this was a hospital-based prospective observational study done for a period of 1 year in Department of Ophthalmology, Gandhi Medical College, Bhopal. All preterm infants with less than 37 weeks of gestational weeks and less than 2.5 kg birth weight attending the ROP clinic was included in the study, and data was compiled and statistically analyzed. So a total of 410 preterm babies was included. Among them, 110 developed ROP and 300 did not develop ROP. And those who developed ROP was further studied for regression or progression of the disease, and fetal hemoglobin was compared between all the groups. So this is the basic demographic characteristic with respect to ROP. So although there was male preponderance but not statistically significant, and those infants who developed ROP had a lesser gestational age and birth weight and statistically significant. This is the mean fetal hemoglobin graph with respect to gestational age, in which we can clearly see that those infants who developed ROP had less fetal hemoglobin levels compared to those who did not develop ROP in all the gestational age groups. Similar findings were observed with birth weight. Those infants who developed ROP had a lesser fetal hemoglobin levels in all the range of birth weight till 2 kg. This is the distribution of fetal hemoglobin with respect to ROP. So those infants who developed ROP had a lesser fetal hemoglobin levels compared to those who did not develop ROP. Similar findings can be seen here in the graph with mean fetal hemoglobin levels with ROP. Those infants who developed ROP, it was found that fetal hemoglobin level was inversely proportional to the stage of the disease. The infants with higher fetal hemoglobin had less severe disease, and those infants who progressed to an advanced disease had lower fetal hemoglobin levels, which was statistically significant. So this is the ROC curve, predictive ability area under of the graph showing 0.974 and the predictive probability. So we can see a clear line at the fetal hemoglobin level of 56%. Those who developed ROP had a lower fetal hemoglobin, less than 56%, and those who developed ROP had a higher fetal hemoglobin level. So the mean fetal hemoglobin was significantly lower in the ROP group than in non-ROP group. Higher the fetal hemoglobin value, lesser was its association with ROP. The concentration of fetal hemoglobin was also significantly associated with severity of the disease. Higher the concentration of fetal hemoglobin, lower was the staging of the disease. More concentration of fetal hemoglobin was found in the ROP infants who regressed, and less concentration in those who progressed to an advanced disease. And all the cases who progressed to an advanced stage has fetal hemoglobin of less than 60%, so it can be concluded that the probability of developing ROP and its progression is less with fetal hemoglobin of more than 60%. So conclusion, low fraction of fetal hemoglobin in the initial postnatal weeks was independently associated with the development as well as progression of ROP in preterm infants. Conversely, maintaining a higher levels of fetal hemoglobin may be protective for developing ROP. And fetal hemoglobin can also be considered a predictor for progression of ROP. This was a hospital-based prospective observational study. Larger studies are required to investigate these associations further. My references.